5 minutes to run through fetal blood sampling so you can have a CTG and move on? Yeah?
We still need them.
I don't know. If you don't need them, I'll stop teaching you. Once I've not heard.
It's not on the new curriculum anymore.
It's not. Okay, well, in that case, you can stop teaching. Unless you're really.
It's still in part 2, though. It's still in part 2.
Okay. Okay. So this is a story. I'm gonna run through this quite quickly. So, me being the crazy me, let's assume I'm now thinking about, I've heard from my friend, the intensivist, that when their women or men or the patients come in and they're really unhappy, I take a blood sample and test it for lactate, pH, and seeing whether their body is going to shut down. No, take arterial blood gases. We all do arterial blood gases, no? We send off those samples and we test them for pHs and oxygen and carbon dioxide and acidity and how much base excess. And that tells them how is this patient coping. Yes? And I think we still use it until this day. It's a
Are you going to tell us that ABGs are unhelpful?
I didn't say that. So we analyze the idea, can I use this for the baby? If an ABG can tell me the overall, how is this person doing, can I do the same for the baby? Okay. Well, the idea sounds clever. Just hang on. Why not? Just don't dismiss it. It's a thought. We're gonna try and invent something. We are in the invention stage. Okay. So ideally, I want this to be arterial blood. Can I take arterial blood from the baby? So this is happening in 1962. Okay. At that point, I can't take arterial blood from the baby. Can I take arterial blood from the baby now? Yes. Ultrasound guided, not taking every 2 minutes, but ultrasound guided arterial blood sample from the baby. Can I do that? Please don't. Okay? Please don't. That will send this baby's arteries into such a spasm. It will die from just that, and you'll end up with hematomas and bleeding everywhere. Please don't. So, okay. Does that mean my mission has failed from even the first minute of thinking? Well, no, hang on. Okay, I am a brilliant mind. I am gonna think, okay, what am I actually looking for? What do I want to detect? Am I looking for hypoxia or hypoxemia? I'm looking for hypoxia. Okay, so when we're looking for ladies lactate, do we take ABGs or can we take a VBG as well? VBG. So VBG tells you that lactate is pretty much the same throughout the entire system. So actually, I don't necessarily need an arterial sample. If I am just testing for the sign of anaerobic metabolism, so lactate or pH, I can just take even a capillary sample. Not a problem. So a valid thought. Agree? Disagree?
Agree.
Agree. Okay. So let's design this. What do I have access for in the baby? I don't have access to the baby's vagina now. Hopefully not. The baby's head. Okay, so I have access to the baby's head. Okay, the head is deep within the lady's vagina. So to get there, I need a speculum. I initially tried a cuspal speculum several times, and I just ended up being drenched by life force. So now I have a nice circular speculum, nice and round, to make sure that nothing is flowing onto me while I'm doing this. Okay, cool. So I have a speculum. I put it in, and I can't see anything at all. I try using the outside light, and I'm always getting in the way. So I've just invented a new light source. Okay. Baby head is very mucky, so I'm gonna use something long to clean it off. Okay. How do I get the sample? I need like a finger prick thing. So, well, it's very long, so I'm actually gonna invent a special sample for that. Okay. I tried pricking the baby a couple of times, blood is just flowing everywhere. I can't. What I'm gonna do is I'm gonna put some Vaseline on the baby's scalp so that any blood that's coming out is gonna turn into a blob so I can actually pick it up. And then I'm gonna get a capillary tube to help pick it up. Yeah? And then I come up with a brilliant thought that I'm just gonna keep to myself for a moment. Fetal chloride. Okay, I have The instrument's ready. Okay, what about position? Okay, I need to get this blood sample from mom. Does the position matter for this baby? So the actual, now, we're now doing the actual procedure. Does the position matter?
Go to the left lateral.
So you want to avoid supine because that's going to make the baby more hypoxic, and it's going to make your results seriously low. Okay, so left lateral. Get her in left lateral on the bed. Knees apart. Then, okay.
Actually, be on nights and sleep.
Yeah.
Draw me like on your bench.
So, and her bottom is too far in the bed, so I'm gonna get her, So I'm gonna get her bottom towards the edge of the bed. Yes. Don't tell me this is amazing drawing. This is just really...
Yeah.
So we're gonna insert the speculum. Okay.
Stop
Backwards. And then,
no, mate.
okay, and now we can actually see inside after putting the light source on. Great. Okay. So to make sure that there's no light coming on, I need to ensure that the speculum is firmly against the baby's head. So that the circle is completely against, it's sealing against the baby's head. Sorry? Well, it has to seal off everything else around it. Okay. And now I need to clean the scalp. Okay. So, and I'm now gonna spray the ethyl chlorides. Why am I spraying ethyl chlorides? So we used to tell the women that we're doing it to numb the baby's head. We're not that kind. We're not that nice. The idea is to cause vasoconstriction, cause deliberate ischemia to that part of skin, so that once the ischemia goes away and there's the reflex hyperemia that comes, I can get a proper sample. Yeah, okay. I'm focused on the blood sample right now, okay? Can see that something's gone wrong along the way. Something's really gone wrong along the way. Okay, so now we're gonna apply the Vaseline, and we are gonna wait for the hyperemia to happen. Then we're gonna do a brief stab. The drop of blood is gonna collect outside, and I'm then gonna collect it into the capillary tube and send that off to be tested. Cool. Okay, now don't forget, always apply some pressure to make sure that you don't bleed. Great. And whatever results come back, and blah, blah, blah. Let's go through the process again. Okay. So, interesting facts. So remember, this is designed in 1962. That's way back. It was based upon the thought that capillary and arterial/venous pHs are all the same. Now, first question, are they the same? The fact that arterial and venous is the same, does that not automatically mean that capillary is the same? Why not? What is the difference between arterial, venous, and capillary blood? So, arterial venous is easy. One has less oxygen and carbon dioxide. One has the excretion things. What about capillary? What is capillary blood? Anyone done a blood sugar test? Do they tell you to squeeze the finger once you prick it? Interesting.
Yeah, so they prick it and then squeeze the blood.
Should you be doing that? I don't know. You tell me. So when you're squeezing through that prick, what are you getting? You're getting blood, and are you getting anything else? Satisfaction. Not plasma, extracellular fluid. Okay, so that's different. You're not just now getting blood, you are getting other body fluids as well, extracellular fluid included. We're not doing that on the baby. So maybe close. Right? The entire process was based upon, let's make sure that this blood sample is similar to this blood sample. So what we did was, we did the test on, we got 12 baby monkeys. So we, close to term, we got mom monkey, give her a GA, did a C-section, delivered baby monkey, shaved baby monkey's head, put a catheter into the arterial the carotids, and then push the finger through the cervix, just enough to dilate it so it can actually take a blood sample. Put the baby back in again, close the thing back up.
How did you get the baby back in? I mean, not you, obviously.
Well, they put the baby back in and didn't deliver.
Didn't deliver them, no. Then you go in, do an FBS, and take a sample from that catheter that you just left in, and they're pretty much all the same. Hooray, hooray, success, success. But you didn't recognize that actually, this baby's not in labor. This baby's not getting through that kind of stress. It's not the same. There's no scalp edema. There's nothing there. This is literally just a non-laboring monkey. And then we decided to, let's do some nomograms. Whatever sample you get, whatever result you get, you have to test on nomograms. Now, nomograms, you can't test on monkeys. You need to test on babies. Okay, so you need a nomogram. How much data, how many patients do you think you need to get a nomogram? So if you're going to say that normal HB level is between 11 and 14, how many samples do you need to say that, get that from the curve? Thousands. 77. Okay. Okay. So when I'm supposed to be doing an FBS, I usually do it because I think that this trace is bad. This baby's hypoxic. Okay. What is the baby usually doing at the time? It's redistributing. That's the first thing that baby does. When it starts becoming hypoxic, to make sure that heart and brain is oxygenated, what is it doing to the skin? It's taking the blood from it. It's actually causing vasoconstriction, and it's causing redistribution. So the skin should be ischemic. So if the skin is actually normal, does that tell me that the baby is good or bad? No idea. Okay? So actually, arterial blood and skin blood should not tell you the same, should not have the same numbers at the time. So FBS 1962, we're assessing mainly for pH to start with. Okay, so baby is surrounded by vaginal secretions, which are acidic, liquor, which is alkaline, meconium, which is acidic. So which one of those do you think is going to affect the result the most? You're taking a 0.1 of a milliliter of blood. Yeah? How much do you need to affect that? Almost nothing. Okay. Which one do you think you're going to get? No. So if there's something acidic, there's something, why not the vaginal secretion? Why not meconium? Remember, all you've done is wiped it off. Have you ever squeezed a lemon? You don't squeeze a lemon and then wipe your finger with tissue? Okay, and then accidentally put your finger in your mouth, you can still taste the lemon. So the acid's still there. You haven't washed the head away, you've literally just wiped it off. And then, so whatever acid alkaline is there, is still there. It's still affecting your blood sample. Okay? If the baby's scalp has any edema, extracellular fluid is now going to come out, and that is going to change the result of your sample. Okay? As you correctly said. So the amount of pressure and the duration of the pressure, remember you have a tight seal against the baby's head throughout the process. If at any point the seal breaks and a bit of lactic comes through, you have to start all over again. Okay? Does that make sense? You're making this entire circle ischemic by pressing on it in a tight circle all around. Not only that, okay, you have literally, deliberately made the skin ischemic to try and get a good sample. This is deliberate. I'm not thinking, so yes, I'm focused on getting the sample, but the reality is I have made this skin ischemic on purpose, waiting for it to actually get me some more blood. Okay? Something's completely wrong. I've literally just lost the track along the way. Okay? Now, if you take 2 samples, so all of us use, like, do an FPS, you get a dot, send off, you send the second one. When you audit those and you do 2 samples, the chance of them being significantly different is 43%. Right? The chance of them actually crossing the threshold, so one being normal, one being abnormal, is 16%.
Why?
Which one of them was more accurate? Because yeah. Or even the first one had meconium, the other one had lichworm, whatever. Okay, so if you're sending off 2 samples, which one do you believe?
Second.
You have to believe the lowest one.
Because it's more accurate?
No, because obviously there is a worst case scenario.
Because it doesn't really matter if there's going to be 40.
Yeah, and if you only get 1, by the way, so which one is it? Is it the better one or the worst one?
The better one.
You don't know.
Why are you even wondering? I don't understand. Who are you playing devil's advocate?
So, to make this worse, this brilliant test, there is no evidence to correlate the outcome to any long-term outcome to the results. The fact that we've been doing this for many, many, many decades now is really beyond me.
When you did used to do FDM, were you often surprised about the state of the baby?
Frequently. So when I was working in one of the hospitals, I was asked by the consultant to do 5 FBSs, so double sample FBSs on the same baby, because that's how far we were taking things. And they were all normal, so 10 normal samples. Yeah. Baby died within 6 hours of severe HIV. Okay. There is actually evidence showing that in comparison to intermittent auscultation, combined continuous monitoring and FBSs, it actually increases your intervention rates. Surprise, surprise. Especially, it doesn't improve outcomes. No. Okay. Sorry? No, it wasn't. I mean, looking back on physiology, this baby had chorioamnitis for 10 hours. Yeah. We just kept it. Yeah. I mean, I didn't, it was beyond me now that we're doing it for the 5th time, but yeah. So when we used to counsel women for complications, I'm doing an FBS, okay? Oh, it's like, have you ever had a blood sugar test? You know, the pinprick and the droplet comes out, we're testing for sugar. Gonna do the same for baby, we're testing it for oxygen. I don't go into the pH thing. That's what I used to say. Okay, is this, okay? And doctor, what about complications? Complications, it's a tiny pinprick. Yeah, okay, that's what I used to say. Anyone who's actually seen, no, I'm not showing any more pictures. No. Anyone who's actually seen an FBS being said or consent for, it's usually down those lines. Okay. But we never talked about the hemorrhage. We have just made an incision on that baby's head. And yes, I said, great, but the reality is most people who do it do an incision. Yeah. Okay, and that bleeds. How much blood does baby have? 350 mils for a 3.5 kilogram baby. Yes. So if it bleeds 10, 15 mils, it's non-significant for most of us. That's 5% of babies' blood. Okay. And imagine if you just made that incision and then you decide to go do a kiwi. Great. Okay. Have we ever talked about what scar this is going to leave? What's it going to look like? Okay. And we never talked about, what about infection? Remember, this is not in a sterile environment. This is within the clean environment of the vagina. And we've literally just, that's when it started being reported. That's the reason when this is there. Okay. So, no, scalp infection and abscess formation, and this baby ends up with a proper infection there, is well known to this. Okay. Where do we take the sample from? Not from the fontanelle. Why not?
Still want to start the brain.
Have you ever done an FBS? Okay. Did you focus on not doing it from fontanelle?
I think I did try and yeah, I did try and do but it's hard. Like once you get the thing in.
I have no idea where you're taking from. Whatever you have access to, that is the reality. You can try and say, yeah, avoid and do and stuff. By the way, does it make a difference? And FSC you can try, and yet you end up with FSCs all over the place.
Yeah.
Okay. But you're trying. It makes a big difference, by the way, where you're taking something from. That's a very important point, because if you're taking more lateral, you're less likely to get close to the central arteries. More central, you're more likely to be ischemic, whatever. But you don't know where you're getting it from. So yes, we try and avoid anterior fontanelle, but CSF leaks are not unheard of. Because remember, this baby has pressure from one side. It's not just about the thickness. If you just do it by a stab, it's about 2 millimeters thickness. But the reality is, this fontanelle is bulging because there's pressure from the other side. And you're pressing from this side. So you're making this quite thin. When you stab, you can get CSF leaks. I had a close friend calling me before I started here at Kingston, saying, "Oh, I've heard that you've been involved with this," because everybody was saying, "Yeah, this was in the old days when people used to use big scalpels." This happened last year with a friend of mine calling me saying, "I've had a baby that now has meningitis because it had CSF leak after an FBS. How can I justify this?" And I said, "I'm sorry, you're coming to the wrong person. I love you, you're my friend, can't help you." Because he did it, and he ended up with a CSF leak. He's an experienced person, because, oh yeah, it's the trainees that do this. No, he's an experienced person. He's been practicing for a good 18 years. Okay, he knows what he's doing. He knows how to do an FBS. The reality is, they happen. Okay? The baby died of meningitis. Okay. When they used to use big scalpels, they used to get broken bits. And this is still actually happening, even though we're using those tiny, tiny ones. So it breaks off. Because we never go and check, is the blue, like Anissa's check the blue part, the blue sign is there on the catheter, you know that. We don't have anything to check on the FBSs. We're not going to design a new thing to make sure it's complete, yeah? And even more interestingly, the hospitals that have stopped doing FBSs, so since we started doing physiology, we have been getting better. Yeah, so FBS should never be done. Now, if you end up with, I was quite old, I'm always the problem kid. So when we started doing physiology and I was asked to do an FBS, I actually used to tell them, okay, fine, you can come and do it. I'm not going to do it. You want to do an FBS, go ahead.
Say, I'm sorry, I don't know how.
So you can, that's one way. Now, I couldn't say that.
Have you still been there?
It was like one consultant once trying to, and then the midwives like
So one of the things I used to do, and that developed along the way for trainees, so SC3s and 4s when we started doing it, because I can say that, they couldn't say that. So the person who has the ultimate last say in the entire matter is
the patient.
The patient.
Go to the patient.
Go and counsel the patient. Tell her, I am, now, this has to be worded very, very carefully. Okay? Because you don't want the patient to lose confidence in you. Because remember, you're the one who's taking care of her. So, now, your baby's trace is not brilliant, it's not ideal. I am obliged by the national guidance to talk to you about all options that's available. There is an extra test that is available, that is taking a sample from baby's head. Okay. We do it in this way, blah, blah, blah. It's taking a sample. The risks are 1, 2, 3, 4, 5.
Meningitis.
Okay. Meningitis, death, abscess, scar. Okay. And by the way, it's not a very accurate test. It actually has less sensitivity and specificity than the actual CTG. You're more likely to have it at least again in an hour's time. Okay. We try and make it as accurate as we can, so we take 2 each time. And we take 2 samples each time. And baby may end up bleeding, baby may end up with CSF leaking to its brain. Okay? Now, I am obliged to offer this as part of that because I need to offer you all management options. This is a management option that is still in practice. Okay? Would you like to go down this route?
then you just write about.
I have never seen some. Yes, I have never seen somebody who said yes. Yeah, why not?
Where still does FPS in London?
Kings definitely still do it. I haven't. Do they still do it at your place? Where you're going?
Home, I don't do it at home. St. Thomas's don't do it.
No,
He's gone now. He's
They
gone
don't do it
to
at me.
We're not gonna name and shame, guys.
No, I just
You're
wanna
gonna
know
tell me
facts
if you
around
if
that.
you end up with
No,
a.
they don't do it at
Oh, definitely. You're going to Tommy's. So Dagmar's there. She works with this. She's gonna support you with that.
I don't know. Like, same day.
Yeah, she's very
Did any of the stock?
Guys,
I don't remember doing anything really.
I remember being very enjoyable. As an ST2,
I did them so much next to one.
unfortunately, I'm gonna have to run, guys, because I'm already over.
thank you, Alex.
Do you have any questions before you go?
No, that's wonderful.
Videos end up on